So let's start with let's start with SI joints since we're already talking about the sponge. SI joints. All right, what's patient's position?
Supine.
Supine. Their cassette is going to be lengthwise, right? Want to make sure it's locked in your buckies. I'm going to start somewhere in the middle because the pelvis is right here. I'm going to start somewhere around there and line up my cassette. So what do I want to make sure I have? Lateral detent, which is already there. And we're going to come and match up with my cassette. Okay. Make sure you guys push this all the way in. And now I don't touch anything else other than my distance. SID, as always, 40 inches with table positions. Does it say anything else in there? Funky? No, right? Okay, good. Cassette size. For SI joints, what was the cassette size? 8 by 10. So at a 40 SID, 8 by 10 is going to be an 18 by 24. So roughly there. Okay. So we're starting somewhere in the middle of the body. I'm going to have the patient, can you bring your shoulders over to the right a little bit? So you want to look at your patients and make sure that they're lined up, they're not crooked or anything like that. If you need to, you can always adjust with the padding as well. Okay. All right, so you do an RPO and an LPO, right? Let's start with the LPO. Okay, so I'm going to take my sponge, the smaller one, don't use the 45 degree. Ask your patient to roll over onto their left side, place the cushion right in the back region right here, okay? Have your patients relax back down. You'll notice it's not as steep of an incline as it was with the 45, right? Cool.
So what sponge was that?
25 to 30 degrees.
Okay.
The lesser one, just don't use the 45. Bring the patients back, good. Okay, which side is up? Which SI joint is elevated?
The right.
My right side is elevated, right? And what's my centering point?
1 inch.
Okay, which side is up? Which SI joint is elevated?
The right.
My right side is elevated, right? And what's my centering point?
1 inch medial from the ACEs.
1 inch medial to the which ACEs?
The elevated.
Okay, so I'm going to find the crest, I'm going to find the ACEs, and I'm going to go 1 inch medial. Here's her ACEs, about 1 inch medial to the elevated ACEs. Would you say that's about an inch?
Yeah.
Okay, there we go. And then again, you move the patient, so always just double check your work and make sure that you're still in the right area, that the patient hasn't rotated when they move. So straighten them out a little bit, okay? So,
Marker. It's the elevated right,
marker?
but so
Yeah, I've seen people do them like this, bottom right corner, because your SI joints are at the top here, right? So the bottom corner, you usually pass the SI joints. So bottom right corner is good. Or some people like to mark the sides down, but I just don't like to go into that area.
I understand.
All right, so right marker. It's just identifying the right side. She's in an LPO, but I'm still marking the right side.
This is another one of the instances where the shield isn't really going to do anything.
Yeah, and this one is almost even pointless to put it on the legs because the patient will be able to feel that it's not doing anything. Because you're in the area now, right? I mean, you can tell that's not doing anything for you, right? Because it's just on your legs. Well,
Would that even hurt if they had like a fractured SI joint or?
The weight of it, you mean?
Yeah.
It could. This is gonna hurt regardless because their body's like in a twisted position. That's why I like those long sponges, the ones that cover the entire length of the body.
Because they can rest with their back and stuff like that.
Yeah, because this is like twisted. What dentistry need?
The right.
The right side, the elevated side, right?
Can we put the marker like on the top corner? This one?
I wouldn't because that's going to be your left SI joint over there. So you might cover. I like bottom corners for these because hopefully your SI joint is about right here, and so you're better off on covering that area. Let's do AP sacrum. Yeah?
Mm-hmm.
AP sacrum. All right, what's my degree of angulation if she's in a 15 degree sit fallacy? So we're gonna go up 15 degrees towards the head, right? Okay. And what happened with my Bucky and my central ring?
It's up.
It's off center now, right? I threw this off, so I have to re-center my cassette to my IR. So we're gonna move down, I'm gonna pull my Bucky out and realign. Perfect, now what? What's my centering point for AP sacrum?
2 inches superior to pubic symphysis.
All right, perfect. So 2 inches superior to pubic symphysis. How do I find pubic symphysis?
Tilt.
So we're gonna find the patient's ACES, patient's crest, ACES, draw an imaginary line down to the pubic symphysis. We're gonna go 2 inches above that point. So there's the point, 2 inches above. And there we go. We have AP sacrum. Again, check your patients from top to bottom. Make sure the patient's aligned. It looks like the legs are a little off. So just fix everything, make sure everything's nice and straight. Okay? Again, with these ones, some people mark both right and left. Some people just mark one side. You do right and left upper corners. There's usually a little bit of air up there, so you have some room. Again, shielding for this is not really possible because you're just in the area. So again, I just, for patient's peace of mind, lay some sort of draping on the legs.
The
Our
size,
angle changes and our what?
field size,
Our
combination.
field size, but also the what? The direction of the angle, right? So remember sacrum when you're looking at look at the pelvis here, our phantom. You see how the sacrum goes back, right, and the coccyx goes forward, right? So we're matching the angle, right, of the sacrum. Now we're going to match the angle of the coccyx. I'll leave this here so you guys can take a look. See how the coccyx goes back up? Take a look at the phantom there. See how sacrum goes down? Coccyx goes back up. So now we're going to match the angle of the coccyx going up. So our degree of angulation,
10 degrees caudal.
10 degrees. That. Good. What happened again?
Bucky's not aligned.
Bucky's going to be out of line again. So make sure you guys pay attention to that. Come back up to this region. And I'm going to move my Bucky down. See if I can make it there. Good. That's why it's important to start in the middle. So that we have that flexibility of like, if I need to go down, I can move them back down, right? Start somewhere in the middle. Our centering point is the same place, right? Same place. So I just have to find it again and make sure I was in the right area. ACES, pubic symphysis, 2 inches above. And now I've seen people do markers on either side or one side or the other again. It's up to you. Shield. Again, can't really shield over the area because this is a small bone and you're going to cover the area of interest, right? Arms out of the way, patient's nice and straight. This is smaller, right? We don't need a full 8 by 10 anymore. 6 by 8. So 13 by 18. It's a small bone, right? Center first, then collimate down. We're going to bring this back down because we're shooting now perpendicular, right? We're not shooting at an angle anymore. So I'm going to line up my Bucky. Push it all the way in. Good. Just like we did for the L spine, I'm going to stabilize my patient first. Bend the legs, flex them up to your hips, roll back the hips and the shoulders. Make sure everything's lined up before you even begin. What do you guys notice that is off?
It's coming this way, so it's got to shift.
Yeah, her back is, she's kind of inclined that way. So I usually straighten them out a little bit more. So their back is headed straight down. I usually use this line, the seam on their shirt, to try to match that up.
Would sponges help for rotation?
Hip rotation?
Yeah, would sponges
Oh,
help?
yeah, so remember, what do we want to be on the vertical to the table?
Vertical?
Perpendicular, excuse me.
Oh.
We want
The
inter-iliac
iliac,
plane, right? So that plane lies between the two tops of her iliac crests, right? So if you feel like she has a narrower waist, larger hips, it might get thrown off, right? And what we'll do is we'll take a sponge. I don't have a comfortable, well, that's not going to be comfortable. Let's see. Probably you mind sitting up a little bit, just like push yourself up onto your side. There you go. And put this underneath your back. Is that okay? It's not too uncomfortable? Okay. So something like that, that wedge to bring up the midsection, and then that will usually line up your interiliac plane again. Okay, you see how that worked?
Mm-hmm.
It did a little bit. A pillow is nice because it's softer and it has two edges that go back down, right? It's concave.
Not that convex.
Convex.
What sponge would you use?
What's that?
If you're shooting this in the hospital, what kind of sponge would you use typically?
The pillows that they have in hospitals are usually radiolucent, so you can just shoot through that. So those hospitals are the hospital pillows are fine. If you have your own in your department that are marked rad, those ones are specifically bought by the radiology department. You can use that as well. It's in the area that we're not using anyway, because it's going to be up here in the midsection. We're working down here, so it doesn't really matter. It's going to be out of the way. Okay. So knees bent, flex, hips flex, roll the shoulders forward, hips nice and straight, bring it back maybe a little bit. You want this to be as perfectly lateral as possible, right? You don't want rotation because then it's going to look thrown off, right? It's going to have some level of distortion to it. Okay, now we're going to find our centering point. What's our centering point for, let's start with sacrum, lateral sacrum. What is it? So, we're going to find crest, ACES. I found ACES here. I'm going to go 3.5 inches back, right? 3.5 inches posterior to the ACES. 1, 2, 3, maybe on my knuckle. Should be about right. That's about 3 inches here, right? 1, 2, 3, 8 inches is about knuckle. Question?
I don't know, I just said it shows it.
Yes. Yeah. So for me, I'm gonna put my finger at ACES, and then that's about 1, 2, 3 inches. Each knuckle is about an inch, right? So ACES, 3 inches back is about your first knuckle. Maybe a little bit more.
Half inch.
Yeah. Like I said, it's gonna be maybe more or less for some people. Cassette size, we're gonna open it back up a little bit, right? The sacrum is bigger than the coccyx. Yeah, so that was 18 by 24. That should be good. Again, check your rotation. Make sure everything's nice and straight. 8 by 10, 8 by 10, right? And she's in what position?
Left lateral?
She's in the left lateral. So usually you indicate this with a left marker. Imagine the sacrum is going down and back. So you're gonna have a pocket right here, perfect spot for put your, it's gonna end up maybe over the acetabulum. That's okay. Our sacrum is at the back of the body. So knees should be superimposed over each other, back nice and straight, knees flexed, lateral position.
Is the coccyx shown in a lateral sacrum?
Sometimes people shoot both at the same time, and all you have to do is open up the length a little bit more and aim just a little bit lower, and you'll get the whole thing. But if they're asking for just sacrum or just coccyx, you have to know the difference.
Got it.
All right, coccyx. Very easy. All we have to do is move down how many inches? 2 inches down. So we're just going to go 2 inches down from this point. Marker, it's still left. Maybe move it up because our coccyx is going up now that way, right? So our sacrum is going back this way. Now it's going up that way. I don't want to touch I don't want my marker to be at the very tip or the apex of the coccyx. Right there. It's smaller again, so we can come down to that 6 by 8 or 13 by 18. That should be enough.
And then are you checking to see if she's straight?
I'm checking to see her rotation, make sure. I mean, I know she didn't move from before, but I'm also just looking at it and imagining it. So sacrum should be going down, coccyx should be going there. Does it make sense?
Mm-hmm.
You see it?
And then on this one, shielding?
Again, not doing much, but something like this.
Got it.
It's usually because you've already been doing an L spine, and maybe a pelvis or sacrum coccyx, and you've been shielding already, and if you take it off in the middle of the exam,
They're wondering
it kind of
why.
raises flags like, why are you taking it off? Like, why don't I need protection anymore, right?
Yeah.
Okay, and that's our, so we did RPO, LPO, AP axial, sacrum and coccyx, and lateral sacrum coccyx, so 6 new views. Okay,
Okay.
any questions?